Okay, let's take a look at this heart model. We have the apex, and then we have the base, where the vessels are coming out of, these large vessels. We have the four-chambered heart, where we have our atria up top and our ventricles at the bottom. On the atria, you see number 2 here and number 51 here. Those are meant to indicate auricles, the appendages on the outside of the atria that allow for the atria to expand, when they're filling. So the auricles are basically the outer flap of the atria. Here you have the pulmonary trunk, which will branch to 2 pulmonary arteries, taking blood to the lungs to be oxygenated. Here you have the aorta, aortic arch, which is going to be the main vessel taking blood from the heart to the systems of the body. So here you have the brachiocephalic, the left common carotid, the left subclavian. Here you have the vena cava that is bringing blood into the right atrium, the superior vena cava, the inferior vena cava, and in the back we have the coronary sinus. Right here, this number 27, coronary sinus, that is also returning blood to the heart from the heart. You have to have blood delivered to the heart's outer walls. Well, this coronary sinus is going to return it into the right atrium. And then the inferior vena cava returns the blood from the lower half of the body. The superior vena cava is going to return it from the upper half. And so you can see these openings in here, these red openings are meant to indicate the openings of the vena cava and of the coronary sinus. Here we see pectinate muscles on the atrium. Here, coming off of the aorta, you see the right coronary artery. Here you see the left coronary artery. And so these are taking blood to the outer layers of the heart. Let's see. I'm going to open this up. And here, once again, to stress, we have the right and left atria and the right and left ventricles. We have valves between the atria and ventricles referred to as AV valves or atrioventricular valves. On the left side, we have the bicuspid, also known as the mitral. It has chordae tendineae that are attaching it to papillary muscles. On the right side, we have the tricuspid. Once again, you see the chordae tendineae and the papillary muscles for attachment. So the papillary muscles will pull on the chordae tendineae to make sure that the valve stays closed when we're squeezing blood out of the ventricles. I want to squeeze like blood out of this ventricle up through this vessel. I want to make sure it goes that way and doesn't go back up into the atrium. So we also have valves between the ventricles and the vessels in which they leave the heart through. So these are semilunar valves. So here you see the pulmonary semilunar valve between the right ventricle and the pulmonary trunk. And then hidden kind of back here behind the chordae tendineae and the left ventricle, it's number 45 there, you can see the aortic semilunar valve. And so those will prevent backflow into the heart. We have to open those to actually get the blood out of the heart. So let's see, up here you see the ligamentum arteriosum, which is a remnant of the ductus arteriosus, which allowed blood flow between the aorta and the pulmonary trunk when our lungs were not functioning, when we were still developing inside mama. Here you can see the conducting system. You come into the ventricles through the AV node and travel down the AV bundle, and then you're going to come up the Purkinje fibers. Take that electrical signal up the Purkinje fibers. So this is part of your conducting system. So we are going to basically, make sure we squeeze the blood from the bottom up. Let's see. What else to point out here? So keep in mind, when we are looking at the blood flow through the heart, that blood is going to enter the left atrium from the lungs through these 4 pulmonary veins. So 1, 2, 3, 4 pulmonary veins coming from the lungs. You can see them on the outside. And they're entering into the left atrium. Blood will then flow into the left ventricle, to basically top off the ventricles, because most of the ventricular filling is done passively, and then we'll go out of the aorta to the systems of the body. And then we will return into the right atrium through the vena cava and the coronary sinus. We will pass into the right ventricle to top off that ventricle, and then that blood will be pumped out the pulmonary trunk to the lungs. So that's the basics of heart flow, of blood flow in the heart. And that's a nice little discussion of the heart model. Back here you can see the trachea and your esophagus, and then you have your descending aorta. So that's some of the major structures. You can look at more of the arteries and veins on your own. I just wanted to get the basics out there.